we were looking to find a new way that we could help with the coronavirus pandemic. We found that although resources have been allocated in multiple places and there's a willingness of the population to donate, there isn't a centralized resource on a global scale that enables both individuals and corporate to do that.
WorldCareMap.com serves as a hub where people in need can access hyperlocal global health resources and take their next step toward recovery.
As you know, the world is right now tackling the COVID-19 pandemic, and we decided to step up and use our expertise undergrid to tackle the COVID-19 crisis, because this is not only a pandemic, but it's also being called by WHO an infodemic.
As an emergency room resident during the COVID-19 pandemic, my goal remains focused on providing the best medical care possible for the patient in front of me. This means that regardless of whether they are COVID positive or presenting with other symptoms, the reason I still go into the hospital is to provide the best care I can alongside my co-residents, attendings, nurses, and staff in the emergency room.
So we created Corona Combat, which is a mobile game that takes its players on a fact-seeking, myth-busting journey, then provides them more information that is sourced through accurate websites such as WHO, CDC, UNICEF, and others.
It is known that information is paramount in tackling a crisis effectively, but not devoid of hope to keep the spirit of the fight.
And I wanted to say thank you for your commitments to action. Fighting this pandemic requires all of us, whether we are on the front lines as healthcare workers, support staff, or essential staff, whether we are staying at home to flatten the curve and protect our loved ones, or whether, like you, we are brainstorming ideas to make our community better. Your commitments to action matter. They make a difference.
Thank you.
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 Thank you. Stay safe, stay healthy, and act responsibly. Thank you so much.
Now joining us, Chelsea Clinton, Vice Chair of the Clinton Foundation. Jenny Durkin, Mayor of Seattle. Dr. Paul Farmer, Co-founder and Chief Strategist, Partners in Health. Dr. Syra Madad, Senior Director of the System-Wide Special Pathogens Program at New York City Health and Hospitals, and Christelle Quizera, Founder and Managing Director of Water Access Rwanda.
Well, good afternoon or good morning, good evening. Thank you all for being with us for this panel talking about how we can learn from this COVID-19 crisis to build hopefully more resilient health systems to help us respond to the crisis and to help us ensure that we're moving forward on public health, health equity, patient health, and so much more into the future. And we're just so grateful for all of you taking your time to be part of this conversation. And I want to start with you, Mayor Durkin, because certainly here in the United States, Seattle and Washington State were very much among our first to experience COVID-19. And I think really what Seattle has achieved has been a model of responsiveness and really building resilience into that response. So could you just tell us a little bit about what's happening in Seattle today and what you think really has worked and what you'll keep going with even after this is waned?
I think the first lesson we learned is looking at the World Health Organization's recommendations was you had to speak with one government. And I think we've been able to accomplish what we've had as a city and a region because of the unified leadership from Governor Inslee to King County Executive Dow Constantine to other mayors here. And so really looking at what we have to do in concerted action, because we know that this virus does not respect any boundaries. I've also had the good fortune to be talking to mayors around the globe. I'm part of C40, and so Eric Garcetti has convened those mayors from around the world on a semi-regular basis now to learn lessons. So we were able to see the lessons that other cities across the world who experienced this first did, and knew that we had very little tools. By the time we saw the virus erupt in our community, our researchers here, and we were very fortunate to have really good health researchers, told us that the number of cases we had actually was far understated. And so working with them and getting the modeling to see that we really were past the stage where we could just do mitigation and contact tracing, we had to move immediately to shutting down parts of our society and our government. And in doing that, we knew that we had to do two things. One was, just as you said, to protect those who are most vulnerable in our communities and protect the healthcare system that would serve us. And second was to know that what we were doing was going to have a significant impact on those who were most economically marginalized. And so we did a dual track at the same time to, one, flatten the curve, and so pretty quickly took steps to turn the dial to really do social distancing, shut down businesses. And we are very fortunate. Our modeling shows that we have passed the peak here, and that we went from what was originally almost a rate of 3 that the virus was transmitting. So for every one person that had it, they would transmit it to 3. Then now we're below 1. And so we believe that we have flattened the curve. We're on the way down. But we know we have to keep this in place for still a significant period of time. And at the same time, how do we open up? So we looked really quickly at building that resilience, as you said, both in the healthcare system and those people most economically disadvantaged, to take some steps immediately to build in that resilience before the federal government could step in, making sure no one was evicted from their home, getting grocery vouchers in the hands of thousands of people, getting loans to small businesses, creating a backbone to do food security. So we really worked hard to be thinking about who are the economically vulnerable as well, and doing that in partnership with the community. And I think you have to think on both tracks at the same time. How do you protect the health of people, but also how do you protect the economic and social health as well?
And, Dr. Madad, could you talk a little bit about kind of what we're seeing in New York City and really across New York State, and kind of where we are today, and kind of what you and everyone you're working with on the front lines is doing to try to help us respond more effectively every day, and also to be kind of more resilient in the future?
So here in New York City, we're the epicenter of the epicenter, and we're still battling, combating COVID on. While we made a current plateau, things can drastically change hour to hour, day by day, and within this plateau, we are surging extremely high. This is obviously not a conventional setting where we're practicing medicine that we normally do, when everything is all good and dandy. We're in a crisis situation. What that means and how that's translating to the front line is the best example I can provide to show really the devastation that's happening here in New York City is during, conventional, healthcare practices. Right now, there's a lot of, discussion on N95s. And so when you're using an N95, you dispose of it after caring for one patient. But because of the crisis situation that we're in, because of so many different factors like, impact to supply chain, you're taking that same N95. Not only are you extending the use of it, of now caring for multiple patients, but you're also reusing the same N95 because of supply chain issues. And so currently here, obviously at health and hospitals, everybody that requires personal protective equipment is given personal protective equipment. But knowing that our timeline, is hours, days, weeks, months, we're not exactly sure when we're going to be, out of this epidemic. We need to continue to have a lot of these resources injected within our supply chain. And so right now, the frontline staff is doing an amazing job, facing COVID-19 head on. They have the resources that they need, but we need to continue to advocate for more resources. We also need to continue to advocate for their own well-being. This is a devastating situation, something that none of us have ever experienced before. We're learning so much, but we're also seeing the impact of this virus, not just on the healthcare system, but also on, the behavior and then the mental aspect of it all. And so there needs to obviously be a lot of support happening all around.
Paul, I know you've seen kind of more outbreaks and epidemics than probably you ever would have hoped to in your career. Whether kind of it's the decades you've spent battling tuberculosis, HIV, malaria, or kind of being on the front lines of Ebola, and now, certainly with COVID-19. Could you talk a bit about kind of what you've learned kind of from Partners in Health's work in kind of Haiti, Liberia, Peru, really everywhere around the world, and kind of what you think those lessons are that we need to be learning in Seattle, New York, and really everywhere here?
I just wanted to pick up on what the mayor and Dr. Madad said. I mean, they're describing two scenarios where the idea was that, it was urgent to attempt and flatten the curve. And that was a term, and just last year, working with you on some writing projects, we were wondering, Chelsea, can we use terms like flattening the curve? Can we use terms like, the peak of an epidemic? But now these are broadly understood, not just by our students and colleagues, but by everyone. And that must be a different situation for Dr. Madad as well. So just going back to this example, which isn't necessary for the speakers, but maybe for some in the audience, in the situation in West Africa, where a number of us, including Chelsea, were involved with the Ebola epidemic, the efforts to prevent the surge failed. So between, let's just say, just to give some months, and again, this is a different kind of virus, but still another RNA virus. In between, let's say, March, May of 2014, when it was first identified as Ebola virus, and a particular kind of Ebola virus, in between then and the 4 or 5 months that followed, the surge was not prevented in either Liberia or Sierra Leone. And so what happened was the healthcare system was completely swept away. It had already been frail, it had already been weak, but it was swept away. And in Guinea, it was badly hit as well. Liberia and Sierra Leone, as you know, had gone through war not too long ago, and these kind of weakenings of healthcare systems tend to be involved in the more cataclysmic epidemics of at least the filoviruses. But it failed. Now, right now, the city of New York, as Dr. Madad said, is the epicenter, and the city of Seattle, thank God, has already seen its peak behind us, and we're all celebrating that. But if you want to get out of going up a peak of cases, you need to think, as has been done in Seattle and as is being done. I mean, one is reluctant to say anything. I'm in Boston, so very safe compared to Dr. Madad, just in terms of access to PPE and how many patients we have coming into the main teaching hospitals. But there, if we look at how to get down from that mountain, then more testing, a lot more tracing, isolation, which is the ideal. It was the ideal with whether it's Ebola or smallpox or Zika, some form of isolation, very different kinds of transmission, but some form of stopping that transmission. So testing, tracing, isolating, and then we can't forget, and certainly Dr. Madad and the mayor have not forgotten, and they won't forget in Rwanda either, that treatment is what people are looking at. It's not as if people come in and say, well, gee, I want to see the epidemic flattened today. It's they're short of breath, or someone they care is febrile or not eating. They want care. So the treatment part of testing, treating, and tracing is critical. And the message that you're getting out there, and I'm sure, again, the mayor has been doing this, I've seen her, and Dr. Madad has made a career out of this, it's saying, we got you. We're here to take care of you. This is not a new contact tracing initiative merely to stow people away and prevent them from transmitting, but also to help them face their symptoms. And that needs support, because as we know, and if I think about the places we've been together, Chelsea, whether we're talking about a refugee camp or internally displaced persons camp or a tenement or a slum, there is such a thing as it being material impossible or almost impossible to socially distance. So that support on top of those, testing, tracing, isolating, treating is really important. Now, the good news, and I'll stop here, and I'm sorry, forgive me when I'm in front of two people who are actually fighting this fight in New York and Seattle, but the way to get avoid climbing up that mountain is that set of steps, but also the way to get down. So for whether we're in New York or Boston, we're trying to complement clinical efforts and the remarkable social distancing efforts of the population, especially those who can socially distance themselves. We're trying to complement that with much more aggressive contact tracing. And forgive me for the length of the comment, Chelsea. I just thought folks at CGIU would want to hear about it.
No, thank you, Paul. And I want to go back to the mayor, but first, Christelle, since the mayor spoke kind of so movingly about what she is trying to do in Seattle in coordination with the governor and the county executive to ensure that people are not being made more vulnerable in this moment, so that they have kind of social support, they have support for groceries, hopefully they have income support and other types of kind of support, so that we're not making kind of the already vulnerable even more vulnerable in this moment. That's the work that you're doing kind of on the front lines, kind of in Rwanda with your work with water. Could you talk a bit about kind of how you're responding to this COVID-19 moment and how your work has adapted to ensure that you're still helping people have access to clean, safe water?
Thank you, Chelsea. One of the things that hit us very quickly at Water Access Rwanda was the reality that most of our beneficiaries, our customers, could not social distance if we didn't get water to their household. So as you know, most of the focus in rural Africa is to provide public access point for water. Since 2017, at Water Access Rwanda, we wanted to provide access to water inside the home to save women time to walk. But suddenly with the coronavirus pandemic and the call for social distancing, that was being pushed as one of the most effective way to stop the crisis. Most of our customers in rural areas could not social distance. They have to walk out of their homes to come and get water. They have to walk out of their homes sometimes to go access a toilet. They have to walk out of their homes to go buy groceries and to go do agricultural activities, which is one of their biggest sources of income. So we had already been on a drive to try and connect people in their homes. But with the coronavirus coming, we really had to speed up efforts to make sure as many families as possible were allowed what is really a luxury of being able to stay at home and open a tap and get water. It should be a human right, but unfortunately in many rural African countries, it's a luxury. So very, very real for us at the beginning of the crisis was how the solution we're offering was so important. But at the same time, we had to look at our public water points as potential contamination areas. So if you imagine, we have all these pictures of people waiting in line to fill up their jerry cans, and usually that looks good. It's more customers for us. But suddenly when you look at it from the standpoint of the disease spreading, all of those are people that can come to our kiosk, get safe water, and potentially go home with coronavirus. So we had to quickly implement ways at the kiosk to enforce social distancing, make sure everybody who arrives washes their hands. And we had to do this within the reality that many people were panic buying and stocking up water because they didn't know, am I going to be able to get out of the house to go get water again? So we had to collaborate with local authorities to be able to manage the water points. At the same time, it was my first time, it was the business's first crisis, really. And we have field officers who have to keep operating so that water doesn't run out. They can still fix issues happening. And a lot of our shipments were stuck. We have a shipment stuck in the US, we have a shipment stuck in China, because there's not yet a big local manufacturing capacity. So we had to really become innovative in the different ways we're making sure the taps are still open, because people need to hand wash. They need that water to still be able to go on with their lives. Water is life. But at the same time, Water Access Rwanda sees an opportunity within coronavirus, especially in the social awareness it's creating about water, sanitation, and hygiene. Diarrhea still kills a lot of people every day in the world. And forgive me, this is the entrepreneur in me seeing an opportunity in a crisis, but we always talk about, wash your hands, prevent the spread of diarrhea, and now you see the public awareness to coronavirus. The same steps we're taking now to prevent the spread of coronavirus are the same steps you can take to completely eliminate waterborne diseases. Wash your hands, have clean water in your house, make sure you avoid the spread of germs, and so on. So we we really like the public awareness he has created, but at the same time, it was a wake-up call. It's doing a lot of advocacy work for us, saying that public points for rural areas should no longer be the standard. People need to have water in their homes.
And Mayor Durkan, I think that's a good kind of segue back to how you're thinking in Seattle about kind of what does come next. How do you kind of move forward kind of through this moment in a way that hopefully is not only kind of opening up, but not inviting kind of back kind of a new surge of COVID-19?
I think it's very complicated because you have to open not just locally but regionally and statewide and be looking at what other areas are doing, because we are a country that travels, and every new introduction of a virus in a community can cause an upswing like we've seen in Singapore. The researchers believe that as much as 80% of the virus we have in our community came from a single transmission. So you have to be really grounded in the science and the health. And I think we have to do exactly what the professor was saying, is we have to be able to do those things we didn't do that led to this crisis. We have to be able to identify who has the virus through very good testing. We have to be able to contact trace. We have to be able to isolate and quarantine. And so we have to have that structure in place, where I think there's no one in the country right now that has that capability. We certainly don't have it in Seattle or in Washington State. And then on the other side, you have to be thinking, what are those sectors in the economy that you can reopen more safely so that you still limit the amount of transmission of the virus? And what are the social things you still have to do, whether it's wearing a mask or social distancing when you're not at work? All of these things, I think, have to work in conjunction. And I would just say, it's really, for me, it is really grounding to hear about Rwanda and the challenges they have, because I think that one of the things for me that has been so different about watching this pandemic develop is that you now have those nations in Europe and America and places that have been supporting some of the developing nations through the previous epidemics. And we are the ones now who are depleting the PPE, the vaccines, the testing materials. And we have to get to a status where we not only start to reopen our economies, we can build the resiliency in our countries and systems so we can continue in those roles that I think, like the Clinton Global Initiatives and others have served for a very long time. So I think that while we've been very focused on Seattle, and that's my job, that's what I do, we are also trying to be really thoughtful about what does that mean for the rest of the region, let alone rest of the world.
And I think, Paul, if we can just kind of return to you for a moment, and then would really appreciate Dr. Madad's thoughts as well. Paul, one of the things you and I have spoken about for so long really is the need for kind of global solidarity, not only because that is morally the right thing to do, but because it is in kind of all of our kind of health interest to do so. And I think we're seeing that so acutely kind of be true at the moment. So maybe you could just reflect on kind of how you're talking to people who maybe haven't understood how interconnected we all are, haven't understood kind of why we should care about kind of a new outbreak kind of in Wuhan more quickly, maybe don't understand kind of how interconnected all of our kind of medical supply chains are in the way that Dr. Madad was talking about. Just how are you trying to help, kind of whether it be your students or your colleagues or the public, understand kind of how reliant we really are on one another, and why recognizing that reliance has to be part of building resilience.
I was just reading a piece by a medical historian. It was really, she was writing, her name's Nancy Tomes, and she was writing in an academic journal at the time of a H1N1 outbreak in 2009 that went into 2010. I'm sure Dr. Madad was already involved in her in her efforts to slow that virus down, if memory serves. So she was saying that there's more of a chance now that the population, the lay population, will understand the need to adopt measures like social distancing. And again, if I'd read that paper carefully when she wrote it a decade ago, I'm not sure if I would have. I think I would have said, well, maybe the American people will do this, maybe they won't. But I'm not sure I would have bet that we'd have ready adherence to some pretty dramatic, like what the mayor is talking about, some very dramatic interventions. And yet we have seen a broad array of the populace comply very impressively with these requests, and the ones who can't. I mean, they often, it's not some cultural distinction that has people of color at greater risk in New York or Louisiana or in Chicago or around Illinois. It's not some cultural, to say nothing of a genetic kind of risk. It's social disparities of risk and social disparities of risk of other chronic illnesses. So just going back to having how young people can get involved, and I got caught out of a little bit about this. Some of the measures that we're proposing, here in Massachusetts that have been done in Seattle, have already involved a lot of students, public health students, medical students. We have the medical students here signing up to begin their clinical duties early. I think we see all around us a willingness to take action. And I'm just hoping that we're going to find more ways in which people can do so, because the social support part of this is critical. It's helping people know where they're going to be safe and where their family members are going to be safe. And then we'll find a lot of people will line up with our recommendations for public health responses, including social distancing.
And Dr. McDonald, one of the things I know you've been so attentive to are the ways in which COVID-19 has preyed on our structural inequities and inequalities, as Paul was just, talking about, not only in New York City, but kind of in Illinois and Louisiana, really everywhere. Could you talk about kind of what New York City is trying to do to kind of recognize that and respond to the ways in which COVID-19 is disproportionately affecting not only kind of our elderly people with underlying conditions, but also kind of Black and Latinos in New York City?
I think, COVID-19 is not just obviously an infectious disease outbreak that's preying on health and healthcare systems. It's actually amplifying, socioeconomic inequalities and health disparities we have across the city, across the state, across the nation. We're seeing obviously a lot of health disparities between African Americans here, also in New York City, Latinos, and it's extremely unfortunate. There's a lot of underlying causes to that, and we need to address these underlying causes if we want to respond better to these types of epidemics in the future. And this obviously includes looking at the socioeconomic factors that go into the social determinants of health. So some of the things that we're seeing here in New York City, one of the things that came out very early on was, one of our hospitals in New York City Health and Hospitals, Elmhurst, that was disproportionately overwhelmed with COVID-19 patients early on, and even now as we're still battling this epidemic. And it was by no accident. It was no surprise that this particular hospital in that particular borough of Queens was so heavily impacted. And if you look at the underlying causes, that particular borough is one of the most diverse urban centers in the United States, and it has a very large immigrant population. Have a lot of Latinos there, as well as a lot of African Americans. And if you dig deeper, you're seeing that a lot of these individuals, when we talk about social distancing and keeping 6 feet away, a lot of them live in homes that are multi-generational. They have a lot of people living under one roof, so it's very hard to socially distance one another. And on top of that, a lot of these people hold, these essential jobs that we talk about. Are the individuals that are, in the grocery stores, and driving taxis, things like that. And so it's putting them at higher risk. And so when we talk about battling and confronting an outbreak and what we can learn from, and applying it to future incidences, we really need to look at some of these underlying causes. Another thing to also look at, it's something that may not even, people may not even think about, is just paid sick leave. So if you're in a job that does not have paid sick leave and you need to put food on the table, then you're forced to go out, and obviously if you're infected, expose additional people because you need to make money. And so they don't have that paid sick leave that a lot of other countries may offer. And so it's basically exposing a lot of these different issues. And so if we want to really address, this one that we're currently in, we need to look at some of the underlying problems that are bubbling up. And, my list can go on and on in terms of some of the other issues that we're seeing, play out with health disparity, not just obviously those that have comorbidities. The other issue is, in the United States, we have a huge obesity epidemic, and what you're actually seeing in the front lines is that actually is playing a very large role in your overall outcome in terms of your case, how severe your case is. And so because of this obesity epidemic, and as well as some other health issues that we have here in the United States, that is also, tied to some of the depending on what race and ethnicity you are, you're at higher chances of having a worse outcome. And so we need to make sure that we have better systems in place, a better safety net system that can help work through a lot of these issues that we're seeing.
Thank you, Dr. Medad. I certainly agree that we are decades past needing not only universal health insurance in our country, but also universal paid sick leave and so many other aspects of the social safety net that hopefully will help kind of protect not only kind of everyone that you're seeing kind of as patients in hospitals today, but ultimately public health more broadly. And, Mayor Durkan, I was struck listening to Dr. Medad earlier talking about kind of the challenges with PPE, with personal protective equipment on the front lines, and then also now, given the universal recommendations of wearing masks, could you just talk a little bit about what Seattle is doing to try to have kind of clear messaging around kind of what people should be doing now to protect themselves and to kind of be good citizens? Kind of what are you doing to try to ensure that frontline workers have access to PPE, and kind of just what else kind of are you doing to still respond to COVID-19, even though you're hopefully kind of coming down the curve?
Yeah, I think, Chelsea, you've really touched on some really important things. I don't know how many mayors knew what PPE was before February 28th, and I can guarantee you every mayor in the nation knows it now. We had to create a Seattle hotline and tool to try to gather PPE from closed clinics, closed dental offices, and the like, just to get enough PPE for our healthcare workers, because we were burning through it so quickly and we could not get it from the national stockpile. So we've gotten to a point now where we believe we have enough in our hospital capacity right now. Because we passed the peak, we have enough both personnel, beds, ventilators, and PPE. But we also know we're going to need more of that going forward. So we found that probably the best messengers for people to do the hard things they're doing right now are those frontline healthcare workers that we all see working around the clock in some of the most brutal conditions, serving patients dozens at a time, going in themselves day after day, exposing themselves. And I think the people of Seattle have done really well. I think that it was, I think, remarkable that we all looked at Wuhan early on and thought, you'll never get that kind of shutdown in America. But yet we've done it. We've come very close, where we've closed down almost all businesses. People are socially distancing. I will say people are starting to get a little restless, and I think it overlaps with the fact that the economics from the federal government have not kicked in, and so people are desperate. We started a rental assistance program that we had to almost shut down within, a few days, because we had so many more thousands of people apply than we had assistance for. So I think our ability to send the message to stay safe has landed well. But for example, last weekend we had to close our parks because we'd seen more and more people coming out trying to get the fresh air, but gathering, having barbecues, very crowded situations. And so we are still exercising that dial to make sure that we don't lose all of the gains that we've made, because people have sacrificed so much to get to where we are. And I think that when people hear that and think about it in those terms, they're willing to keep doing the hard things. We are going to emphasize coming up people wearing masks when they go out. That is a strong recommendation from the CDC. It's not required yet in any Washington state city, but we're talking about making it required because we know as we move to the next phase, because as we will have not enough testing, we have to do everything we can to protect people when they are out.
And Paul and Christelle, just a question, really building on something that Christelle mentioned earlier, and Paul, that you and I have talked about for a long time, the ways in which kind of outbreaks and epidemics are especially dangerous for women. Although kind of COVID-19 seems to be kind of hitting men hardest in some ways, we know that kind of outbreaks prey on kind of the normal pathways of care, and that so many caregivers are women, whether that's kind of caregiving in the home or kind of what Christelle was talking about, the caregiving of going out to seek water every day. And Dr. Madad spoke about kind of the ways in which COVID-19 is hitting kind of Black Americans and Latino Americans so painfully hard in New York City and really around the country. But, Paul and Christelle, could you talk about kind of what messages we really need to be kind of delivering, especially to women caregivers, whether in Rwanda or Haiti, Paul, in Boston, really anywhere? And Paul, maybe you can speak, and then Christelle.
In a way that we did not, as the mayor said, we did not know just a few months ago. This is a caregiver's disease. It's going to affect caregivers disproportionately. We know what that looks like from Ebola, also a caregiver's disease that not spread by the respiratory route, but again, in the course of taking care of your loved ones, or in the final act of caregiving, which in most religious traditions is respectful burial of the dead. So I think we're going to see these same risks. Who are our caregivers? Who are our frontline workers? Are they well supported? Again, just a few years ago, we might not have had such an easy time advancing a discussion about universal health care and, disability insurance and unemployment insurance. And as Dr. Madad said, these are, these have hove into view as clear cofactors for poor outcomes for many of our those most at risk. So I'm hoping, as you are, Chelsea, and I know Christelle is too, that we can have a broader discussion when the time is right about what our societies have looked like. The reason that we are borrowing from Rwanda and learning from Rwanda in the middle of this crisis is following their crisis. They spent years doing soul searching and had to address questions, including who should have health insurance. And I was living there at the time, and I'm embarrassed to say that I thought, this was about 2002, I thought they're never going to pull this off. They're never going to have a health insurance that really reaches the vulnerable. And that was incorrect, because if you believe that will never come to pass, you'll be a prophet for sure. So I'm counting on us learning from Rwanda a lot of messages that I think would be useful in New York and Seattle and plenty of other places as well.
And Christelle, either
I feel like
kind
I
of
was
react
preaching.
Oh, well, you can always, but so either reactions to what Paul said or kind of the questions I raised.
Yeah, for me, I think one thing that really came to the surface is how the overall condition of women, or the realities of many women, especially in vulnerable areas and groups, have really become worse because of coronavirus. For example, every time I log onto social media, everywhere in the world, there is a higher report of cases of gender-based violence and sexual harassment, sexual assault by family members, things like that. But at the same time, as you touched on, women are the caregivers. They are the ones who spend a lot of time taking care, doing unpaid domestic work. And for me, the biggest focus is water, of course, which, as the numbers estimate, women globally lose 40 billion hours a year just working for water. Something that could easily be piped to them, just a matter of infrastructure. So it's been quite, as a woman myself, to see that staying in the home also brings danger to other women. I hope really as this ends, we also have more courage and more drive to address the issues that make homes unsafe for women or a place of suffering for women, instead of being a place of relaxation or a place where they can stay in to feel safe. Because we're staying home to be safe, but some women are staying home and having their condition exacerbated and actually putting themselves in danger. So that's what I could add.
Can I
Really,
add one thing,
Please,
Christelle?
Paul.
Just to add to something and I may have missed it. Christelle may have said it, but Rwanda offers other lessons, of course, and it's not an accident, as Christelle may have said when I was off, that Rwanda has the highest fraction of women parliamentarians, and Mayor Durkan is I think the first woman mayor of Seattle, and let's be aware, at least I am as the only guy on the phone, that when we lose out on women in positions of leadership, we also lose out on innovations that are going to make us all safer and make a caregiver's disease have less of a burden on the caregivers. So, in case no one else said it.
Yeah, one of the best things has been to see how all the women leaders across the world are really stepping up and leading this, like the bosses they are. So I've been quite the fangirl watching and, trying to do my best with my team of a few people here in Rwanda. So it's women really are running the show in a beautiful way.
And I think, Chelsea, if I might add to that, there's a health well-being part that while women aren't as disproportionately the victims of the virus, I think there's going to be some long-term mental health and fatigue issues that women are still shouldering more than others. Not just the domestic violence, which we touched upon, but so many women who were in the workforce, as soon as our schools shut down and people are working from home, they are doing childcare. Sometimes they're caring for adults and seniors. They're trying to do their job. And so they're playing all those roles, and they're disproportionately the healthcare workers. So I think that society still has not caught up to the wellness that women are going to need, particularly coming through this pandemic.
Yes, I completely agree. And in our final few minutes, as I think all of you know, CGI University, had we been able to meet this time in person, would have had more than 800 students from more than 100 universities in almost as many countries around the world. And so just as you think about kind of that audience, what do you want young people to know? And if you had advice for how young people could engage, would that be to kind of sign up as contact tracers? Is that to check on their neighbors? Is that to ensure they're being gentle to themselves, kind of to Mayor Durkan's point? Kind of reaching out for whatever kind of help we all may need in this moment of uncertainty, and also reaching out to help in this moment of uncertainty. Just any kind of advice or suggestions, I think would be really appreciated by our students. And maybe, Christelle, we'll start with you since you were a CGIU student, and then we'll kind of go around my screen. So kind of Christelle, Paul, Dr. Medad, and then Mayor Durkan.
Yeah, my business was actually a few months old when I attended CGIU. I founded it 1 year before I graduated. And I guess it's kind of, it's been 5 years in the making, but being able to address this crisis in a real way, providing something like water, hand washing stations that are really now big healthcare commodities, has been quite exciting and a good result for the work we've been doing. But the advice I would have for students watching right now is to try all they can do and not wait. I don't know how to phrase it the right way, but the skills and talents they already have right now are enough to contribute to something real and tangible that can have great results. So from, I've been looking at examples of other young people around the world, from those delivering groceries to the elderly, to those who are helping with the social distancing by doing live shows every day on social media, So there is all kinds of ways young people can really take leadership and contribute to the efforts of what's happening. We need to be aware as young people. But the other part of the puzzle is to look forward to the world after COVID-19, to the aftermath. What are the opportunities that coronavirus is opening up? How does the world need to be after coronavirus? What lessons are we learning as young people to deal with the next pandemic? So those are all social entrepreneurship opportunities opening up. So anybody thinking of a solution right now, step up. I've seen many people release apps to help with data tracking, and you do that in one night. So that's the power of young people. So keep it up. Whatever you're able to contribute, do it. There's nothing too small. And look at the aftermath, because there is opportunities opening up.
Great, thank you, Christophe. Paul?
Well, I'm going to just, like in the hospital, Dr. Madad will remember this, when the senior physician writes a little note, says agree with the above, so he or she doesn't have to write a long note. I agree with everything you said, Christelle, and I have a hunch that I'm going to agree with Dr. Madad and the mayor and you. So can I say something a little bit negative just for young people to be aware of? This term resilience has a scary side to it too, right? When I think about some of the conditions that Dr. Madad is facing and that we will in our clinical work, exposing frontline workers, whether firefighters or nurses, to heavy and sustained doses of COVID-19 or whatever the virus is not showing anything about resilience, and if you're not giving them enough PPE, how can they be resilient? How can people in refugee camps and slums to practice social distancing? So here's the challenge. Since I already work with students in everything I do and never had any good experience without working with students and believe that they can do everything that we've described, just be careful when you hear people talking about resilience as if it would be reflected in the middle of an earthquake in Haiti when a building falls on someone. We gotta remember that the only thing that makes something resilient is community. It's all of us working together. It's a city coming together. It's a Department of Public Health coming together. It's a neighborhood coming together around water. So I'm going to keep saying it. There is no resilience without the we part. And in studying why we fail, for example, how do we fail women who are cooped up in cramped apartments for unexpected weeks? We'll find out. And then the resilience part is what we do collectively to turn to the most vulnerable. Again and again, it's serving the most vulnerable that we need everybody engaged in.
Great. Dr. Madad?
So, echo what has already been said, but a couple of things I'd like to add to the conversation is there's a lot of work to be done. And these types of situations require an all hands on deck approach. So we want to make sure that people are still investing in going into science and technology, research and development. Some of the things that you're seeing come out here in New York City because of some of the significant impacts and issues, supply chain, our workforce, you see these wartime factories now popping up. So, you're seeing a lot of individuals now converting their shops into developing face shields, developing isolation gowns, things like that. And so there's a role to play for every single person. So whether you're a student, whether you're a polished or seasoned, healthcare professional, whether you're a clerk, in a grocery store, all of us, have a role to play. And we need to make sure that we understand what are the needs and how we can meet those needs. And right now, we're in a crisis situation, so the need is much, much greater. But we also need to look at, after this crisis is done, what can we do to make sure we learn the lessons from this current crisis, and we're in a better position for the future, events that are going to come down in the pipeline. We know that it's inevitable; they are going to occur. And so, students play an extremely large role in helping look into some of the aspects that we have experienced, and then investing in some of these careers that will help combat the next pandemic that we're going to face. And obviously, just in the last decade, we faced a number of different infectious disease outbreaks, whether it's Zika, Ebola, measles. New York City obviously just, overcame this, a huge measles outbreak. One of the things that we experienced, not just combating the actual outbreak itself, but this contagion of misinformation And so, with students, we want to make sure that people are getting informed, educating themselves, knowing where to go to, and then helping the community understand some of these basic facts. And so, when we talk about these health disparities earlier, if you're coming from a background where people need more information because they don't understand what the public health guidance is, playing a role in providing accurate and trustworthy information to these individuals. And so all of us play a role in this. It's not just the healthcare workers, it's not just the elected officials. Every single one of us has a role to play in outbreak response.
And yet we do know that elected officials really matter. So Mayor Durkan, to give you the last word, kind of what would you say to young people kind of in Seattle, but really anywhere in the world, about kind of what you would hope they would be doing, that they would be thinking about what they could do like now in the future to respond to COVID-19, but also to what we've heard before, help us be more resilient for the next time.
So Chelsea, I will say that everyone, what we said, what we can do to get through this, I agree that young people can help carry us through this. And we've all seen the tragedy play out on a family by family basis, a community basis across the globe. And it's, the word unprecedented is used so many times, and this is an unprecedented event in history. But I think the thing that would be most tragic is if we did not learn the lessons that we've seen here, the inequities that we've seen play out through this pandemic. And that's what the young people are going to have to do most, your students and students across the world, to make sure that as we come out and we rebuild society by society, that they are the force that makes sure that all of these inequities that we see now in glaring relief, that we actually do something about them going forward. And that will only happen with the activism and energy that we've seen the youth do, like in climate and other areas. And so my urging is help all you can through this, but we are now in a world marathon where we really have to reshape who we are as a society across the globe.
I completely agree. Well, hopefully everyone listening will be part of that marathon. Thank you, all of you, for everything that you're doing. Thank you for your time this afternoon, or whether maybe it's this morning or this evening. And we're all incredibly, incredibly grateful. So stay safe, stay healthy. Thank you all.
I'm Katrina Villas-Cisneros, and the future is fighting for human rights.
The future is fighting the opioid epidemic.
The future is fighting climate change.
And protecting natural resources.
Tackling domestic violence.
Empowering refugee women.
Zero discrimination and equal job opportunities for everyone.
Equitable access to education.
Tackling substance abuse.
The disaster resilient world.
The future is empowering the next generation of leaders.